Blood calcium regulation and bone remodeling. Although bones do not seem to change much once adulthood is reached, bones continue to remodel themselves throughout life. Bone remodeling is the continual changes in bone resulting from changes in blood calcium levels and gravitational and muscular forces pulling on bones. Let's start with some vocabulary for bone remodeling. Hypocalcemia. Low levels of calcium in the blood. Hypercalcemia. High levels of calcium in the blood. Osteoblasts. Bone building cells that deposit calcium in the bone matrix. Osteoclasts. Bone destroying cells that remove calcium from the bone matrix and release it into the bloodstream. To control blood calcium levels, osteoblasts and osteoclasts regulate the deposition and dissolving of bone. When blood calcium levels drop below normal, PTH or parathyroid hormone is released into the blood. Osteoclasts are stimulated to break down bone matrix. Blood calcium levels then rise. When blood calcium levels become too high, calcium is deposited into the bone matrix by osteoblasts, thus lowering the calcium levels in the blood back to the normal range. For bones to retain their proportions and strength as they grow, bones must be remodeled. Bones grow in length at the epiphyseal plates and articular cartilage, and grow appositionally in the periosteum. If the bone is not remodeled after growth, its proportions and thickness are abnormal. Osteoclasts remodel the bone to restore its normal thickness. Bone is reabsorbed from the outside and inside of the bone shaft. Due to the remodeling process, bones can retain their proportions and thickness as they grow. Bone remodeling can also occur during adulthood in response to gravitational forces and the pull of muscles. In the center, we see an average bone. On the left, there is a thinner bone. Bones that are not exposed to much stress become thinner and lighter. Less bone matrix is deposited by osteoblasts. On the right, there is a thicker bone. Bones grow thicker in certain areas in response to stress. Osteoblasts deposit more bone matrix in areas of the bone exposed to more stress.